Good afternoon, happy Saturday. I am Sanjeev Pandya. Namaskar, hello and welcome to the Ayurveda Mantra show by Santigram Kerala Ayurveda Wellness Center USA. In this weekly show, we talk about importance of Ayurveda and how Ayurveda can cure and prevent almost any disease, and that's what Santigram Kerala Ayurveda Wellness Center basically cures almost any disease out there. One of the founders of Santigram Kerala Ayurveda Wellness Centers and Ayurveda doctor for over 30 years, Dr. Ambika Nair, joins us in this show every week to guide us and educate us about Ayurveda. Once again, I'd like to welcome Dr. Ambika Nair to this show. Dr. Nair, welcome, and how are you?
I'm fine, Sanjeev. Thank you so much for inviting me for the show.
Correct.
Thank you, my viewers. Hope you people are enjoying it. Any queries, you're always welcome to contact us.
Thank you so much. And you know, Doctor, we do this show every Saturday, right here on TV Asia. And that's because after Monday through Friday's hard work and you know all the trouble that you go through, this is when you wind down and you relax a little bit and you figure out that how to take care of your body and how to live a happy and healthy life, correct?
Especially, you know, like Monday to Friday means afterwards, you know, when they say open, oh, I will be talking about, you have to take care of this, you have to take care of this,
Correct.
you know, which will create, I should say, that little anxiety in them to make their health better.
Exactly, and
Yeah.
that's actually, this is very informative show and to educate you and to guide you about Ayurveda, so that way you can live happy and healthy life. Today we're going to talk about obesity. Dr. Nair, as you know, about 69% of Americans are obese. Out of that, 31% are called be-obese and 7% are beyond obese. I mean, they're very overweight, and this is an epidemic. It has affected many people's lives and everything, and in our community, South Asian community, it is also growing. So can you tell us what is obesity?
Obesity, actually, you know, in Ayurveda, what we call it is a staulya.
Achha.
Staulya means, you know, you ferment beyond the limitations.
Correct.
Okay, you eat little bit, you put on weight. This is what, you know, people always ask me, Doctor, I don't eat much, you know, like they are right. This is called kapha. So kapha means, you know, like that is with water and earth in your body. So water content is more. If anything is more also, it will go like, you know, like aggravation. So this is all called kaphaja. So anything that you are according to your body mass, you know, according to your weight, if it is beyond the 30 means, you know, that you will be called as an obesity it is. Yeah.
So how can you keep that in control? How can you keep your body, you know, which is not affected by obese or not overweight?
Actually, it is like an epidemic now, and it is a real medical problem these days. Actually, people are really, you know, and it is very difficult to bring them also, even with the surgeries and all they are doing, you know, even afterwards also. At that time it will affect little bit, but again it will go beyond that. Only you have to think how to control it. Only the person has to understand why they have to be out from obesity because of the diseases also.
Correct.
Because actually in Ayurveda, because of our sapta dhadus, you know, that whatever we eat, it will first, you know, like it will, it has to digest, then it has to, you know, like come to the blood, then it will be assimilated in our body, then again it will go to the, you know, like body mamsamatya, then, you know, like then to the bones, then to all the other, you know, like sperms and all those things, you know, it is always like a cycle. So when the medha, that is the fat, it cannot, you know, assimilate to support the bonds, then only the fat accumulation comes. You can see, you know, how people, they will come around the, you know, like all the bony areas, like or around the shoulder. Some people, they cannot even breathe. Okay, that's one of the things, we will always see that actually. So first of all, it is with the digestion. It is a classification. Okay, when you start putting on weight itself, you should see a physician or any Ayurvedic doctor or anybody whom you like, because I don't say like you come to me or anything like that. I'm telling you.
Correct.
Okay, so then we see that in Ayurveda, we see that what is the root cause, whether it is related with the vata. Some people, because fat people, they eat a lot sometimes. Because of the fat means, their digestion is more. So they will eat a lot. So they put on a lot of weight. It is actually with the eating habits a lot. They eat a lot. Availability of food is also there.
Yes, exactly.
So much availability. Advertisements, you eat this, you will become alright. You eat this, you will become alright. But like there are so many things contributing factors for that actually.
So is there a single reason what causes obesity, or there are multiple reasons?
Multiple reasons. First of all, digestion. Okay. Then comes, it can be genetic also. If mother or father has any thyroid issues, whether diabetic, then they were taking any medications for the, for the mind, like a depression or anything like that, anxiety, this all causes these issues.
All right.
Yeah.
Hold on to that thought. We're going to take a short break, and when we come back, we're going to talk more on obesity in this episode of Ayurveda Mantra by Santigram Kerala Ayurveda Wellness Center, USA. Welcome back to the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Centers, USA. Today we are talking about obesity and what causes obesity and what is obesity, and a lot more to learn from Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Centers, USA. Before the break, we said, what actually causes obesity?
Combination of excessive eating and lack of activity.
Correct.
Because once you start putting on weight, you don't feel like going. That's why, people come and tell, like I go to the gym, but I go and do the exercise for like 2 hours minimum, and they don't even lose, 1 pound.
Yes.
Okay. So this is a common thing that people come to me.
Correct.
So then, and they may be taking some other medications also. This is excessive weight, this is morbid kapha, we call it as. And their eating habits are also very good. Some people, because nowadays the awareness for the better health is very good. Actually, it has become like a wellness now.
Yeah,
actually, very, very few people only, because actually once they grow
Ah.
beyond that weight, that inferiority complex comes.
Correct.
So they feel that if they listen to us, that itself is something bad.
Okay, it's good to know that people in our community really want.
No, they are very good now these days.
Acha.
Yeah, like endocrinology, that is with the hypothyroidism and any disorder, any pituitary gland disorder or anything like that. Anybody who takes a lot of medications for the even cortisone injections, even for the osteoarthritis, osteoporosis, they take a lot of medications.
Okay. Question comes to my mind as you say that excessive eating and lack of exercise.
Yes.
That's one of the reasons. Today, obviously, as I always say, that we live in a very competitive world, and our life is very stressful. What we eat, today's food, let's just say that it's really hard to find completely healthy food. You pick anything and it will have artificial flavor. It will have some kind of ingredients which are not right. It will have it will have artificial color also.
Definitely.
So today's food includes one or more than a couple of things which are bad for you.
Yeah.
But you have no choice and you're eating that, right? You take vegetables, you take fruits, you take grocery products. There is always going to be something which they will say it's not right for you.
Yeah, I will also say it's not right, but I know it's very difficult to find a good place like that.
Correct.
So, that's why so many people are, like organic.
Absolutely.
Organic we are getting these days, but still, everybody should start growing their own little vegetables.
But not everybody can afford organic also. It's a very
Vegan,
expensive.
it is very expensive, like 4 times it is,
True.
I know.
So then how a person can take care of his or herself, a body, and then not to be in the category of obese?
Yeah. Kapha people, like see, if you want to be out from diabetes, because the complications are like a big line of complications for the kapha people. Kaphaja, the diseases related with the obesity. So that is more important. So, like when you have a craving for sugar, you should think that you are going to be sick. You are inviting diabetes. Okay. Diabetes doesn't get established within like just 1 or 2 days. It will take unless it will be a drug induced one. Okay, because there are certain drugs also which induces all these things. Okay, stop eating sugar. Okay, absolutely no sugar at all. Okay, then like excessive taking of like cheese. So much cheese is being used in this country. Actually, see, where we came and we never had this, like abundance of eating every day, so much of all days, like cheese or anything like that. Here, everything is related with the cheese.
But in the European countries, right, they eat cheese a lot. Cheese
they eat, they work out, they work.
But in America is the only one where obesity rate is much higher than the countries in Europe or in Africa or in Asia.
See, actually, like kaphaja diseases is, like in ancient times it was, like abundance. For wealthy people, wealthy means, oh my God, he is very wealthy. We can know that, but now it is not like that.
No, that's obviously not the case.
So, like you see our Africa, how many obese people you can see?
That's a good point, in Africa you
hardly anything. In Zambia, Zimbabwe, you just see how they eat. There is nothing. The way we waste over here, we can send over there actually. Something has to be done for that actually.
But it's a good point that in Africa you don't find people who are obese. In Europe, people who don't find you. I think it's a country that we live in here in America.
Yes.
And then maybe perhaps in some countries in Asia. Let's say, for example, India. India is the largest country when it comes to consuming sugar in the world.
That's what I was going to tell.
Correct. So sugar plays a very important role. Then you mentioned cheese and dairy products plays an important role.
So much of it, like we eat a lot of yogurt. Actually, yogurt should not be, consumed like that. It should be like buttermilk. Yeah, that has to be replacement. And I'll come to the diet, then I will talk.
Okay. All right, we're going to take a short break, and when we come back, we'll continue to talk about obese in this episode. This is the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Centers, USA. Welcome back to the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. And I am with Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center, USA. And today we're talking about obesity, which is an epidemic. And many people, I shouldn't say many people, but many people are affected with this epidemic called obesity. And then people who are obese, they fall into that category. Which I think they find it very hard to have it cured or prevented.
To reduce.
Obesity leads to many other diseases also, and one of them is depression.
Very bad depression.
Okay.
And see, when they do all these exercises, they go to different doctors and different works out, like then and the diet plans, this plan, that plan. Like in India means they will go to VLCC, they lose weight, and the moment they stop it, it will come back to them.
Correct.
Because they are not treating for the cause. The cause has to be treated. That's one of the important things in kapha, disorders. So like so depression means what they will do when their mind get affected, they will overeat, total overeating. They are not hungry, but they will eat everything. ये भी खाएगा वो भी खाएगा सब खाएगा still like and then like a sleep apnea. These are all the disorders of the obesity actually. That is one of the reasons. We have a lot of clients who comes and avail our services in Santigram Kerala Ayurveda, and when they come we do the pulse reading and we start with the treatment plans. First of all, we the diet plan, and like a Panchakarma will advise. And not only Panchakarma, there are very good, that we call it as, in Ayurveda it is called Uddhavardhana. Uddhavardhana is like polishing of the body, so that, whatever the fat accumulations, it will be converted, like that. They lose a lot of weight, and this all prevention of, like diabetes It's a very good treatment actually.
Ji.
So diabetes, arthritis and obesity. So we have like a lot of clients who comes to us.
Santigram Kerala Ayurveda Wellness Center USA is known for its very genuine and very special Panchakarma treatment, and especially when it comes to obese, they really take care of obese patients very well. Question comes to my mind, doctor, as we are talking about this obese, is it genetic?
Some people it will be genetic. So like see, when that's why like I always tell before conception itself the parents have to take a real plan how to conceive a child, like this has to be, like that's why we do in Panchakarma and make them understand. So that's a detoxification. So like 80% of your problems will be solved. Then you are educated how to go further. In Panchakarma also we do the Nasya treatment because the entry over here, so the sleep apnea patient also will be all right. And the Vastis are there, then all related things we always do it. It's very nice actually.
Okay.
And Abhyangams which will improve the circulation, all accumulation of the lymphatic system, everything will be reduced in that.
All right. Another question comes to my mind, doctor, is what I have seen, and I have noticed that many people, and that number is growing, when they lose hope being obese, and then they tried allopathy or medicine and nothing worked out, right? And then that's when they really lose hope and they go for surgery, liposuction, any other surgery. What do you have to say about those individuals who go for surgery? Is it really good idea to go for surgery?
This is a very good question actually. Like I have like a few clients who comes to me after the surgery, like a few years, but they had little issues. I am not telling that they were completely perfect. Some people were completely perfect, but some other ailments were there. I am not telling that these are the complications. Please don't misunderstand me. Okay, so these are not the complications, but other things were there. But some people were benefited also with the diabetes, because you see they will cut short the colon length and some ballooning, everything they do, because they come and tell me. And some complications where they could not eat at all. So these are the complications.
Well, they can't eat at all, and then whatever they eat, they have to eat in a very moderate amount.
Very minimal amount, and they were finding it very difficult also. Then when they come according to the need, I was taking care of them. Correct. Actually,
Okay. So my point is that when someone is obese, someone's overweight, and when they come to Santigram Kerala Ayurveda Wellness Center, which we're saying is that it really can obviously help to cure any disease and also prevent before it gets too late, right?
Yes.
So Santigram Kerala Ayurveda Wellness Center, when a patient comes in, right, where do you start from step one to guide that patient?
Step one is with the diet. So I will always tell them, what diet they should eat. No sugar first of all.
Achha.
And cut down your carbohydrate. Okay, second one. And instead of sugar, I always tell them they can eat the fruits. Okay, when they get up in the morning, they should drink only warm water with honey. Okay, 1 tablespoon of honey. It should be tepid warm, not that very hot. Okay, that will become a poison. That's not right. Okay.
Absolutely.
Then throughout the day they should take only warm water, because everybody everywhere it is available and they can do it.
Correct.
Okay, and for their morning breakfast and all, they should eat the proper diet, not that in between like munching.
Now you suggest a proper diet for people who are vegetarians and people who are
anybody
non-vegetarians.
see, when we do the detoxification, we make them vegetarians, whether it is American or, and they listen to us than our deshis. Okay, so it's not an issue at all.
Correct.
Who never even had any vegetarian food, but they are willingly like to change.
They are more cooperative than our community.
Not only that, 100% cooperative.
Achha.
Yeah,
Okay,
they are
good.
very nice actually.
And then the last question I have for you is that how many calories per day you suggest to these overweight people?
According to the body structure, according to their
let's say,
obesity,
roughly, approximately.
like it can be like 1600.
1600
Yeah,
calories.
that's
Okay,
it.
but
But some people,
approximate.
like according to the, because we cannot abruptly stop it. So slowly only it will come.
All right.
And we tell them to take some fruits or something like that. we will stop all the, which produces the kapha. Okay, and some 80% of the people, whatever they eat, it doesn't defecate, so we tell them, so that some herbs are also given, so that will help them a lot actually for everything.
So viewers, just to give you an idea, is that a proper diet plan, exercise, and a complete treatment, therapy treatment at Santigram Kerala Ayurveda Wellness Center can really cure disease like obesity or any other complications which follows obesity, and that's what Santigram Kerala Ayurveda Wellness Center is all about. And in this weekly show, Ayurveda Mantra Show, we talk about importance of Ayurveda and how it can actually help you to live happy and healthy life. Dr. Nair, once again, thank you so much for helping out our viewers, and thank you for sharing very useful information.
Yeah, and I tell them that, you all should take only warm water, morning and evening. You can take a triphala, okay, gulgulu or triphala, like a powder, half teaspoon every day according to your weight, if you are like a big adult, you can take like a 1 tablespoon, with water, warm water, and teaspoon of honey. You can mix and keep it. You can have it in the morning and try to reduce your carbohydrates. There are so many things available in our India, so everything is available here also. You can always choose it. If you are taking fruits and all, wash it. At least dip it in water for half an hour minimum, so that if at all any pesticide or anything is there, it will just go away. It will not bring any more complications for you.
Very good. Thank you so much for that tip, Doctor. And viewers, if you have any question related to Ayurveda and if you want to know anything in detail, please send us an email, info@santigramusa.com, and any health related question that you mentioned, Dr. Ambika Nair in the next episode will definitely address that question and will suggest a cure. With that note, Dr. Ambika Nair, you have a good weekend. Viewers, you have a good weekend, and remember to take care of yourself, live a happy and healthy life. And this is the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. I am Sanjeev Pandya, thanking all of you for watching the show on TV Asia.